All right, let's talk about some of the filters we'll be using in this video. These are bacterial viral filters, and they all look different, but they do the same thing. These are going to be placed in line, and they will filter that virus that's getting exhaled. These are actually HMEs, heat moisture exchange, and these are placed in line to create humidity for the patient. But these particular models, these two, also double as a filter. There's actually a HEPA filter on one side of it, okay? So it does this, it says both of them for you. So make sure if you're using an HME, it has both. With
the coronavirus, we want to create as few droplets as possible. So low flow oxygen is recommended. So that means nasal cannula, oxygen no more than 6 liters. Okay. We could also take precautions, extra precautions by using a mask. Of course, COVID positive patients should be in a negative pressure room using airborne precautions such as a capper, PAPR, or N95 mask. Now, high flow nasal cannula is not recommended for COVID-19 patients. However, we still may use it. Okay? So the best way to do it safely, put a patient on, and we could also put a mask over that. But absolutely, when transferring patients from room to room, put on one of these masks. So with the COVID-19 patients, this isn't recommended. Why? Because this aerosol makes a delivery system for the virus. It makes these bigger molecules, and it can carry several of the viruses out, making it an airborne threat. So what are we going to use in place of this? We're going to use MDIs with a spacer. So the way that we use this, so real quickly, take it, have our patient exhale, fire the medication, and then slowly inhale. If you do it too fast, you'll get this warning whistle. Okay, that's not a good thing. Okay, we want to do it nice and slow. So it's possible we may have supply chain problems, so we could make our own spacer if we don't have one. Now, why do we care? This is about 75 to 85% more effective than just using this. Okay? So to make a makeshift spacer, we could use materials that we have. We're going to take a neb kit, an air mask, make sure that it has the holes in it, our medication, and electrodes. Okay? And so what we're going to do is we're going to take this, we're going to take the reservoir tubing and put it on the mask. Make sure the fittings are tight. We're going to take the electrodes and completely cover these holes. And now you take the medication, and it should have a tight fit in the tubing. Okay? And so here's our spacer. And to administer this, you just put it on the patient. Get a nice tight seal, and then administer the medication. So while we may not be using this system for COVID-19 patients, there may be some safer alternatives to give a nebulizer than this. For instance, this filtered nebulizer. The way that this works is it has one-way valve here, one-way valve here, and then it has a HEPA filter here. So when we do our breathing treatment, inhale here, it's exhaled here. So whatever we exhaled is filtered. So this might be a safer alternative to give than this one. There's also this, the breath actuated nebulizer. Okay, and the way that this works is you don't even get aerosol until you inhale it. So it's very much like an MDI. So that might be safer also. Okay. So we have our filtered neb, and then we have our BAN, our breath actuated nebulizer. Another safe alternative is the Aerogen system. And see what this does is it takes our medication, and instead of that aerosol, it makes this fine vapor. Okay? These droplets are smaller and they won't carry the virus as far. The Aerogen people have come forward and said that this is safe for COVID-19, but they also say it should be done placed in line just to keep it safe. And that's usually how these are used. These are used placed in line on ventilators, BiPAPs, and they're given via mask and things like that. But we can create a closed system for this with things that we have. So we're going to use a BiPAP non-vented mask, very important. You don't want the ones with the holes in it. We're also going to use our delivery system, and then we're going to put a HEPA filter on the back of it. Okay, so we're going to load this all. This goes here, and then our filter goes here. Okay, so when we put this on our patient, they're going to have this closed system, and they'll get the medication and exhale it filtered. Okay, we have a nice tight seal. They're getting the medication and they're able to breathe because we have this filter, and it's safer. We want to avoid all humidity and aerosols like this. Bland aerosols, dangerous, just spreads this virus all over the room. So we want to avoid anything like this. So what if we have a patient who has a tracheostomy and they're getting humidity? How do we humidify that patient? Now here's our typical setup for a patient that has a trach and they're not on the vent. We'll give them a trach collar like this, gives them humidity. Now we don't want to do this with our COVID-19 patients because it's just going to spread those droplets all over the room. So we're going to have to take this and we're going to have to make a closed system. Okay, and so what we're going to do is we're going to get our inline suction he was using on the vent. It's a trach size. Tubing, and if this particular inline has a tubing with it, so we're going to use it. We're going to connect that. We're going to connect this to this side. And then for the end, the exhalation, we're going to put another filter. Okay. So there's our inline closed system. Okay, we put this on our patient. We have our humidity, we have an inline suction, and the exhalation is filtered. If having to transport a COVID-19 trach patient, make sure you have one of these, a portable HME, put in line. That will filter anything they exhaled.